All right, good evening, Chicago. I'm Dr. Allison Arwady, Commissioner of Health at the City of Chicago. I'm joined here by two of my colleagues from the Chicago Department of Public Health. This is Christopher Shields. He's our Assistant Commissioner over Emergency Preparedness and has been in charge of a lot of the logistics of COVID-19 distribution and planning and lots of other work related to the behind-the-scenes work in our COVID response. And then on my right, this is Dr. Candace Robinson. She's our medical director for communicable disease and has really been leading on the medical side related to COVID vaccine. And so these are two of the busiest people in Chicago right now, but we are all taking some time this evening to answer some of your questions. Before we begin our presentation, I want to be sure that the participants who need simultaneous language translation services have an opportunity to access those lines. We know there are hundreds of languages spoken in Chicago, but we can provide translation services for our 6 most commonly spoken languages. So I'll leave this up on the screen, and please, if you want to hear translation in Spanish, call that first number and use the access code, and then similarly for the rest of these languages. We'll wait just a moment to make sure that our neighbors have a chance to dial in. Okay, so let's go ahead and begin. Our town hall today will focus on the COVID-19 vaccine. We'll talk a little bit about safety, we'll talk a little bit about distribution, and then we really want to have time to answer your questions. We know there are many, many questions in the community about how the vaccine will be distributed, how we're confident in its safety. We're going to answer as many of those questions as we can. But for questions that we're not able to answer tonight or that we don't fully have the answers to, I want to point you to our website, which I'll show you. We continue to update really every day a lot of the frequently asked questions there. And if you put questions in that we don't get to, and they're questions we get commonly, we'll update it there. You can put your questions tonight directly in the chat box, and we will get to as many of them as we can. And we plan to use most of our time live to answer those questions. But first, we're going to move ahead with a just short, high-level presentation related to COVID vaccine. First, this is our website, chicago.gov/COVIDVax. And if you've gotten used to the chicago.gov/coronavirus website, same website, but right up at the top, there's a link that will take you to vaccine. And as you can see on the page here, there's a lot of information, and I really encourage you to explore this. We've got latest updates, we've got things about vaccine planning, get the facts, frequently asked questions. There's a section for healthcare providers, and then there's a download section where we increasingly are having materials available in many languages, and we are updating our top line messages every week. You can download these, you can share them, you can put your own logo on them along with the City of Chicago. We really want to get the facts out about COVID-19 vaccine in Chicago. I'm going to turn it over to Dr. Robinson just to go over some of the top 5 main points. Again, there's more detail on the website.
Yeah, absolutely. One of those links that on that website that you just showed is called the top 5 things to know. And I kind of wanted to talk about these because these are common questions that we get asked. So the first one is the safety of COVID-19 vaccines is a top priority. No steps were skipped in the clinical trials process for these vaccines, and we're going to talk in detail a little bit about that later on. Safety checks are in progress and will continue. And so, people who receive the vaccine will have the opportunity to enroll in a program that uses your phone to follow up on you and ask questions about your vaccine and how you're feeling afterwards. So these safety checks are in progress, and they will continue. Number 2, COVID-19 vaccines do not use live virus and cannot give someone COVID-19 itself. So mRNA vaccines will be some of the first COVID-19 vaccines authorized for use. And they use mRNA to train the body to respond to the COVID virus without using any live virus. So it is impossible to get COVID-19 from the vaccine. Number 3, vaccines may help keep you and people around you from getting infected with COVID-19. And it's a safer way to build protection than getting COVID-19. Getting COVID-19 is really the only other way to make those antibodies against COVID-19. And we really never know how COVID-19 will affect us, whether we will be the mild case or a more serious case. So the vaccine is really the safer way to build the protection. And the vaccine is recommended even if you have already had COVID-19 and have recovered. Number 4, currently COVID-19 vaccines require 2 shots, and everybody needs both shots to get the most protection. So the first shot really starts to build protection, and then the second shot is needed to receive the maximum coverage and the maximum protection from the vaccine. Number 5. Supply of this vaccine, particularly in the beginning stages, is limited, and so certain groups will be prioritized. The first groups prioritized to receive vaccine are our healthcare personnel and our residents of long-term care facilities. And so as more vaccine becomes available, additional priority groups will receive the vaccine based on federal guidance. So some of those groups can include essential workers, persons over the age of 65, or persons with medical conditions that put them at higher risk for severe COVID-19 disease. And it's important to note that the vaccine will be at no cost to all Chicagoans once larger quantities become available. So cost will not be a barrier for receiving this vaccine.
Thanks. We're also getting a lot of questions about vaccine safety, and some of these came in even before we started. So just very high level, we wanted to review clinical trials. The same process for evaluating safety and effectiveness is used for every vaccine in the United States. The process that the COVID vaccine went through and continues to go through is no different. So all of these vaccines go through years of preclinical trials. Even these new mRNA vaccines, that's the Pfizer vaccine, which is the only one at this point that we are using in Chicago. It's the only one that has the authorization from the FDA and the CDC, but also the Moderna vaccine, the one that is just being considered today. They went through many years, more than 15 years of preclinical research. And then after the laboratory research is done, trials are done what's called phase 1, where a few dozen volunteers volunteer to receive a brand new vaccine. And the biggest question, are there any safety concerns? And then they're looking, does the vaccine seem to work, and looking to see what dose may be best. If that goes well in the few dozen volunteers, you move to a phase 2 trial with a few hundred volunteers. Again, are there any safety concerns? We start looking at short-term side effects, and then draw blood to see how does the immune system respond in these few hundred people. Only if a vaccine flies through with beautiful results in phase 1 and phase 2 do we move ahead to a phase 3 trial. And the phase 3 trial is really where the rubber meets the road. You give thousands or tens of thousands of volunteers the vaccine. But importantly, we give half of the people in that phase 3 trial the vaccine and half of them a placebo. They get a shot, but it's just salt water. So there's no actual vaccine in it. In these phase 3 trials, we're again, first and foremost, looking for any safety concerns, but then we're looking to see, does the vaccine actually protect people in the real world? So the Pfizer vaccine, for example, had 44,000 people enrolled in its phase 3 trial. And so in this phase 3 trial, you'll sometimes hear the words double-blind, randomized, or placebo-controlled. Here's what that means. These phase 3 trials are double-blind, meaning on the left, both the researcher and the person receiving the vaccine do not know whether they got the real vaccine or whether they got the placebo. And that's because people might take different actions if they knew they'd gotten the vaccine. They might report side effects differently. And so we keep it blinded to both the participants and the researchers. Only behind the scenes are there pharmacists and computers that know who's gotten which. It is randomized, meaning half of the people get the vaccine and half of the people get the placebo, as you can see in the middle here. But again, we don't know. The individual themselves does not know. And then it's placebo-controlled, meaning half of the people get the placebo as a control group against the half that got the vaccine. And then what happens is all of these people are told to live their life, keep wearing their mask, keep protecting themselves against COVID, and we compare the vaccine group and the placebo group. So the 22,000 people, give or take, who got the vaccine against the 22,000 people who got the salt water. Again, first and foremost, any safety concerns. And then, does it work? Who gets COVID? Does the vaccine actually protect people? A vaccine that doesn't work at all would show the same number of people in the placebo group as in the vaccine group getting COVID. And then what side effects do people report? And so where we start looking at the actual data, this is the actual data from the Pfizer vaccine trial. And the safety data first was very good. They followed everybody for at least 2 months. That's what the FDA required, and no serious safety concerns coming up. But in terms of efficacy, so down in the bottom left corner, this marks day 0. Everybody gets that vaccine, half placebo, half vaccine, or everybody gets the injection, half placebo and half vaccine. And then we follow forward over time. And each of those red dots are COVID cases in volunteers who received the placebo, and each of the blue dots are COVID cases in volunteers who received the vaccine. So what we can see is for about the first 11, 12 days, there were a number of COVID in both the blue and the red group. But then starting a little bit after, really less than 2 weeks after that first dose, we started to see some protection. And then they measure 7 days after the second vaccine dose. And after that point, there were only 8 cases of COVID in people who got the vaccine and 162 cases of COVID in people who got the placebo. So that's how we know the vaccine was 95% effective in preventing COVID-19. That is a fantastic outcome for a vaccine. The FDA had said they would approve a vaccine even if it was 50% effective, but to see a vaccine performing this well was really good news. And then there were no safety concerns identified, but some vaccine recipients did report short-term side effects. Those side effects are not COVID-19, as Dr. Robinson said. They are the body producing that immune response, building the protection, and they generally lasted 1 to 2 days or even less. We can see, for example, that more than 3/4 of the people who received the vaccine did report some pain at the injection site, compared to 12% of the people who got the placebo. A much lower number, 6%, had some redness or swelling, compared to less than 1% who got the placebo. And then where we look at the more general effects, more than half of the people who got the COVID vaccine in the trial said that they had some fatigue. Now, if you look, almost 1/4 of the people who got the placebo also said they had some fatigue. So you can see why you need to have a comparison group. But nevertheless, we do see some of these short-term side effects. Less commonly, we saw fever or diarrhea or vomiting or joint pain. And interestingly, these side effects were all less common in volunteers over the age of 55. And that's probably because people who are older tend to mount a less aggressive immune response. It's some of why they get sicker with COVID, but it also means that they're less likely to potentially have some of these short-term side effects. So the safety profile on this also absolutely beautiful, but some of these side effects I do want people to know about, because if someone gets their first dose of vaccine, has pain, has a headache maybe for a day, that is just your immune system kicking in, that is not getting COVID, and we do want to make sure people come back to get that second vaccine to be fully protected. And then I want to turn it over to Christopher Shields to talk a little bit behind the scenes. You saw a lot of pictures on Tuesday of the first recipient in Chicago getting the vaccine, but there's a lot of work that happens that you don't see, and we wanted to highlight some of that.
Yeah, so what we're going to be looking at here is how does the vaccine arrive at the final destination? A lot of questions have come up. Does the city of Chicago follow the same protocols as the federal government? And absolutely we do. If you're looking at the picture on the left-hand side of the screen, you're seeing flight containers. So each one of those flight containers contains the medical ancillary supplies needed to perform a vaccination. So your alcohol wipes, cotton balls, Band-Aids, the syringes, and the needles. And also within that box would be a thermal shipping container, which actually contains the vaccine. So you can see that we've lined up several boxes there, and on top is a form that's called our transfer of custody document. So on the right-hand side of the screen, you see Dr. Robbins filling out the transfer of custody form. Dr. Robbins is our lead pharmacist here in the city of Chicago, and he is following the FDA prescribed procedures to ensure that vaccine that we are moving from our controlled facility follows the chain of custody protocols until it's received at its end user location. So this is a series of slides to talk about the 2 types of vaccine movement that we're being engaged with here in the city of Chicago. On the left-hand side of the screen is a picture of an ultra-cold freezer system. So you've heard a lot about Pfizer vaccine is currently stored at a -80 Celsius Dr. Robbins is currently filling out Dr. Robbins is currently filling out his transfer form. He's pre-identified how much vaccine he's going to pull from that freezer system. He's filling out the form to identify the time that he is moving that vaccine out and its final destination. And then you see him pulling out the vaccine in the freezer. The lower left-hand corner is an image of the vaccine tray. So that vaccine tray contains 195 doses of the Pfizer Ultra Cold. We take that tray and it's dropped into the middle image there, which is a -80 thermal container. So that vaccine goes into its payload container, is then covered with dry ice, and then sealed. On the right-hand side, you're looking at boxes that are green in color. This is vaccine that moves at our traditional temperature, 2 to 8 degrees Celsius. We use a system here in the city called Greenbox, which is a thermal exchange system. So we have phase change panels contained within our thermal shipper. One is in a frozen state and one is in a liquid state. And over time, the frozen state becomes liquid and the liquid state becomes frozen. And that allows us to maintain the temperature integrity of that box. While we're packing out vaccine, we also include a data tracker within that thermal environment. And that sends a signal to our receiver system to tell us every 10 minutes, what is the temperature of that vaccine? It follows our compliance protocols and ensures the integrity of the vaccine during its movement from a storage facility to its end location and ultimately its dispensing location. In the upper right-hand corner, that's just an example of a report that we pulled down to show the number of movements that occurred on a particular day. Were there any challenges identified in that movement, or were there any breakage in the temperature of the device? So you can see on this particular report, there were 6 movements on that day, and there were no breaks in the temperature compliance from storage to end receiver.
And the last thing I wanted to highlight was a lot of the outreach work that is going on. Many of you may be familiar with the Protect Chicago initiative. If you're not, chicago.gov/coronavirus, right up at the top, there's a tab for Protect Chicago. This is an initiative that has already begun to bring the best, most up-to-date COVID information to Chicagoans where they most need it. There is broad outreach happening related to phone banking and peer-to-peer texting. There have already been more than 100,000 text messages set, and we're on track to reach 1 million Chicago cell phones by the end of January with good, up-to-date COVID messaging. We also are using safe passage workers. They've been going door to door, bringing COVID care kits. So 150,000 households have already received or will receive these care kits by the end of the year, and we're on track to reach 400,000 households by February 1st. Also been working with many of our community-based organizations on messaging. There's more than 250 nonprofits and religious institutions who have been pushing out our weekly messaging to their constituents. We really appreciate that. If you have other ways to get messaging out, we'd love to connect you in. And then we go from the broad down to the most targeted. We've also have some neighborhood networks to provide more intensive outreach in 5 zip codes that have some of our highest rates of infection. And the good news is that all of the vaccine work is going to fold into this Protect Chicago outreach initiative. So right now, a lot of our messaging, of course, is about wearing your mask and social distancing and how to quarantine and how to get tested. But as vaccine starts to become more available in the general population, we'll be using a lot of this same infrastructure and same partners to be able to get the message out. So thank you for tuning in. This is really the end of our formal process here, and we will turn to your questions. Protect Chicago, of course, is the name of our initiative, and I encourage you to look at the website and send us questions in the box below. So we've already got a number of questions coming in, and I think we can, let's take this one. Eunice Teddy Winston Jr. is asking, how can you be fully protected if it's 95% effective? That means you could still get COVID even if you've gotten the vaccine? Dr. Robinson?
Yes, you can still get COVID even if you've gotten the vaccine. And if you look at the slide that Dr. Arwady showed from the vaccine trials, you could see that some people who got the vaccine did get COVID. However, the amount of people who got the vaccine that got COVID was much less than the number of people who got the placebo who got COVID. And so really, you need those 2 doses of the vaccine to get the most protection that that vaccine can offer. But it's not a 100% protection. And no vaccine that we have is a 100% protection, but it minimizes, the chance, it decreases, I should say, the chance of you be getting sick with COVID.
Yeah, and I would add to that this is part of why, particularly early on, as this vaccine is launching in the setting of a lot of COVID still here in Chicago, we are still going to recommend that people are wearing their mask and social distancing and protecting family. As we move further along and COVID itself starts to come under better control, the individual risk will go down. But we are going to be, broadly as a society here, wearing masks still for some time. And the good news is a vaccine that's 95% protective, that's some of the best numbers that we've seen for a vaccine. If you look at our flu vaccine, for example, every year we have to make a new one. It's nowhere near that protective because there's been a lot of different strains of flu. There's a lot of mutations. Every year you need to make a new flu vaccine. This one, on the other hand, is really looking good. There hasn't been all the mutation in COVID, and the protection is good. But you are right that there is no such thing as a 100% protective vaccine. Okay, Laurette Thompson-Cooper is asking, how long does the vaccine last? Will it be 6 months like the flu? Do you want to start with that one?
I'll start with that one. So, as this vaccine comes out, there's still more we have to learn about this vaccine over time. And one of those questions that scientists will be looking at over time is how long does the protection last from that vaccine? And so that's something that we will be learning as we go along here. But the scientists are looking at that. They're following up the people in the trials, and they'll be following up certain people who receive the vaccine to get that information. And we'll know more over time.
Absolutely. All right, there's a number of questions coming in from physicians and dentists, so I'll just read a couple of them together and then we'll start with them. So we've got one: I'm a physician working in an outpatient urgent care center in Chicago. Our clinic is not affiliated with a hospital. How can healthcare workers in Chicago who are not affiliated with a hospital register to receive the COVID vaccine? And then I see Wasei Jatoy, who says, I'm a dentist in Chicago. Is there a time frame for when non-hospital healthcare workers will receive the vaccine? And will there be a website portal for healthcare workers to sign up? So I'm going to let you start answering that question, and then we'll fill in.
Absolutely. So absolutely, there will be a time for our non-affiliated medical providers to receive vaccination. Our team is currently building out points of dispensing locations or points of vaccination locations. These will be facilities throughout the city where we'll run an online registration system. You'll be able to register for the vaccine and then receive your interdiction. We're doing this in the early stages as there's still limited supply of vaccine in the general marketplace. But we are very optimistic as vaccine continues to come into the city and additional vaccine supply is received, all City of Chicago people will be able to receive their vaccine. But to your specific question, yes, as part of Tier Group 1A, our medical providers will be prioritized to receive vaccine, and if they are not affiliated with a hospital, they will be allowed to register into a closed point of dispensing location, which we'll be establishing in the weeks ahead.
Do you want to add to that?
Yeah, and we will be looking on the lookout. There is some more information coming out to providers. We've sent some information via some of our listservs that are specifically for providers. There are additional communications coming out, so please, you will get additional information about this if you're a provider.
Yeah, literally this afternoon, we were just proofing. There will be an email address that will be going out to all licensed physicians who are licensed in the state of Illinois who report a Chicago address with some more information about this. And at the highest level, for folks who are working in very large outpatient clinics, especially if they're not associated with a hospital, we will probably be doing some distribution of vaccine there for staff. And then for smaller ones, as you heard, we will be on an appointment-only basis, be working folks into our mass vaccination or our point of dispensing sites. My expectation is that will broadly kick off in January, and more details to come as we learn about how much vaccine we have available and as we continue to make progress through first our hospital-based healthcare workers and then our long-term care facilities. So we hear you, and we are planning and excited to get to vaccinating our outpatient-based healthcare providers, really just, starting in likely a few weeks. Okay. Araceli Cabrales Medina is asking, will the vaccine be mandatory once it becomes widely available to the public? So I can maybe start with that one, and then either of you should feel free to chime in. So at this point, it's really premature to be talking about mandatory vaccination. So there's two pieces that I'm interested in seeing before this is even, I think, very relevant to the conversation, but I appreciate the question and people thinking about it. One is that the FDA still has even our very first vaccine under what's called emergency use authorization. There will continue to be data collected. There will continue to be additional information over the next few months as we follow up, as you heard, all of the people receiving vaccine. And the vaccine will be fully licensed, we would expect, in the weeks to come, and that will play through. And for me, really, knowing that a vaccine is fully licensed would be part of likely making it mandatory in any setting. But the more important piece is that before we think about making a vaccine mandatory in any setting, we would want to know that that vaccine is very widely available, that there are not barriers for people who want to get the vaccine. And that is months away, just to be perfectly honest with you. So I can tell you that there is no chance that the city of Chicago is going to say every city of Chicago resident must get vaccinated. That's not going to happen. But I think that it's likely that we will see perhaps businesses or other settings making a decision to potentially require vaccination. I've already seen, for example, some of the airlines have been signaling that later in 2021, they may be looking for proof of vaccination for people who want to fly. So that's what we can say about that right now. There's a very active conversation. But really, our goal at this point is to encourage people to learn about the vaccine, to feel confident in the decision that they make to be vaccinated when it is their turn. And we will be keeping track, of course, of everybody who's getting the vaccine will be in the vaccine registry, so that down the line, if there are situations where people need to prove vaccination, there will be ways to do that. But we are a long way, months, really, from that part of the outreach. Good question. All right, Asvin Lad is asking, where will those who are immune compromised, such as cancer survivors, fall in line? How will we be notified and be required to validate our condition? So there's a couple pieces on that. Why don't we start with you, Dr. Robinson, and then come to you?
Yeah, sure. So we will get more guidance from the federal government, and actually we anticipate getting additional guidance as soon as this weekend about who the next groups recommended to receive the vaccine will be. And we do expect that it will be potentially essential workers and people over 65 and those with conditions that put them at increased risk for severe COVID-19 disease. And so we will be keeping our website that we highlighted first, the www.chicago.gov/COVID-Vax website, up to date with what phase of vaccination we're in, who's recommended to receive it, and as we open vaccination to these more and more groups, and we open our vaccination clinics, as Christopher talked about earlier, we'll be putting information on how people can access those clinics and sign up to be vaccinated.
All right, and do you want to speak a little bit about the validating the condition part?
Yeah, absolutely. So when the registration opens to each one of these tiers, you'll be afforded the opportunity to go in, self-register, and then self-validate that you have these types of medical conditions or this underlying symptomology that then ensures that we are going to vaccinate people in their appropriate tier level. So the reason we're doing an online registration is also to assist us in ensuring that you get your second dose. That notification associated to this vaccine is coming back to you. You're not reliant on a piece of paper or remembering to write it down, that the system of registry will then flag for you that I need to come back for my second dose X number of days after I receive my initial dose.
Great. And I just wanted to highlight, in terms of how will you know when it's your turn, there will be a lot of information coming out as vaccine opens up to others. So in the same way that we did quite a large press event with the first people getting vaccinated and highlighted, 5 individuals there, people who were nurses and patient care techs and doctors in the hospital setting. That's where we started. You'll see some more news when we start with the long-term care facilities. You'll see some more news when we start with outpatient patient providers. And certainly as we continue to expand out, we'll be highlighting when this is available. The last thing to note is that we really intend to push this vaccine to our partners as much as we can. In our planning assumptions, the City of Chicago and Chicago Department of Public Health are only expecting to vaccinate about 10% of the vaccines in our large points of dispensing, or our mass vaccination clinics. That's still a lot of people, and there will be a lot of logistics there. But we will be working to provide vaccine to your doctor's offices. As there is vaccine that can be stored with the appropriate cold, right? There's a lot of logistics, as you've heard behind this. But we want people, especially people who may have underlying conditions or may be older, may have questions about the vaccine, to be able to be vaccinated through their provider. So we expect to use a lot of partners for that group in particular. And in the essential worker, we expect to probably be pairing some of the very large employers with vaccination partners. So you can imagine, for example, grocery store workers, that maybe there's something set up where we pair a vaccination partner with the grocery store, and people who work at that store would potentially be able to be vaccinated on site at work. So all of this is down the line. None of it is starting yet, probably for a number of months, and you will hear more detail as we get to you. But I don't think it will be a surprise when we start bringing these other folks in. And we are not going to make people bring in medical records or do long interviews about your medical histories. We will be asking people, though, as Chris said, to be honest, as they're explaining to us about their medical history and why they're appropriate for vaccination. But that's a few months away. Okay. We've got a question. Is it safe for people with allergies to get the vaccine? Do you want to start with that one?
Yeah, sure. So there is guidance from the CDC about vaccine in persons with allergies. And the guidance is based on what type of allergy you have. So if you've had a severe allergic reaction, also known as anaphylaxis, to the COVID-19 vaccine itself, or to any of the ingredients in that vaccine, then you should not get the COVID-19 vaccine. If you've had a severe allergic reaction to another vaccine or an injectable medication, then you may be able to get the vaccine under certain circumstances, but you should talk to your provider about that allergy, that you let them know that you've had that allergy, and then make the best decision for you. If you've had a severe allergic reaction to like a food or environmental exposure or something else like that, then you can receive the vaccine. And I think it's important to note, everybody who receives this vaccine will be asked to wait and be monitored for 15 minutes after you've received that vaccine. And if it's deemed appropriate for you to receive the vaccine, if you're in that middle category where you've had an allergic reaction to an injectable medication or another vaccine, we'll actually be asking you to wait around for 30 minutes after you receive that vaccine, just so you can be monitored after vaccination.
Yeah, and we always, not just for COVID vaccine, but for any vaccine, we always have with us the medications in case somebody were to have an allergic reaction. It's something we're always prepared for in our points of dispensing and otherwise. Did you want to add anything to that?
Right. Within the point of dispensing site, very similar to your traditional medical home, we do keep medications there for an individual that might experience an allergic reaction. So epinephrine and Benadryl are the medications that we will have on site should an adverse event occur at that time. But as Dr. Robinson and Dr. Arwady had already identified, we are not forecasting a large segment to have allergic reactions, and CDC has identified those particular groups, especially with the injectable vaccine already identified as an allergic reaction.
Yep. So if anybody has, questions about your own, allergy history, please do reach out to your doctor and have that conversation. Okay, we've got a couple of questions here related to equity. Jennifer Brown is asking, how are you going to make sure the vaccine is distributed equitably to marginalized communities and those with high positivity rates? She's also asking, when can the public, the last of the phases, expect to receive the vaccine? So we'll come back to that. Kim Jeffries is asking about Black and Brown residents. When will they be in line for vaccination, seeing how they are at greater risk? Do you want to start with that? And then kind of answering those together, what are we doing about equity in marginalized communities? It's actually a big conversation. So
yes, absolutely. So we are doing a few things to ensure that everyone has access to this vaccine, as their group is recommended for vaccination. We will be running our vaccination clinics at sites throughout the city and spread kind of throughout the city so that we can get those people into those sites and from lots of different neighborhoods. Another thing we're doing is we're working with our partners, and like Dr. Arwady said, we expect a lot of this vaccination to occur through our partners, through outpatient clinics, through pharmacies, et cetera, to make sure that there are vaccination places where you can be vaccinated in all the neighborhoods. We actually look very closely at the zip codes where rates are the highest. We look very closely at the zip codes where people in certain categories live. Where do our healthcare providers live? We'll look at where our persons who are 65 and older live. And then we will use that information to help us work with partners in that area to ensure that vaccine is available in those areas.
Yeah, I think something else I would add is that one of the reasons I highlighted the Protect Chicago initiative is that outreach effort is very much in line with the Race Equity Rapid Response Team, with community organizations, and it recognizes that there needs to be high-level messaging to everybody, but then some more targeted outreach and conversations to areas that are, at the current point, who are hardest hit related to COVID. We also will be monitoring down the line here and making public where people live who are getting vaccine, what are the zip codes, what are the race, ethnicity, what are the ages, and we expect, just as we've done for testing, to push additional outreach resources to the parts of the city that we perhaps are seeing lower vaccine uptake in. We expect that we may see lower vaccine uptake in some of our communities of color, even though they've been some of the hardest hit. And we also anticipate that based on some of the surveys that have been done, people who have lower education levels may be less likely to want to take the vaccine right away. And so there will be a lot of additional work, really thinking about who are trusted messengers in this space. So we want to match healthcare workers who, once vaccine is more widely available, who have gotten the vaccine themselves and are knowledgeable about the vaccine, who live or work in a particular zip code. We want to match them with community groups or neighborhood block groups or others in that same zip code to be able to have a conversation with the general public and answer people's questions. We expect questions, we want them. The other thing is that all of this, we won't be listing sort of race and ethnicity as a category for prioritization. We won't say, now Latinx people come to get vaccinated. What we will do is do additional work to lower the barriers and to do everything we can in some of our hardest hit communities to both get information out, but also make it as easy as possible for people to be vaccinated. So just to give you a sense of that, even within healthcare workers broadly, the Chicago Department of Public Health has done some mapping of using census data where healthcare workers live in Chicago. And actually, even within that, breaking down healthcare workers, there's about 400,000 people who are healthcare workers in the city. So this is why it's going to take us a few months to even get most of the way through that group. But even where you break this down and you divide it into some of the highest paid healthcare workers, so our doctors, our nurses, our therapists, our dentists, they tend to live more in the Loop area and on the north side. Not always, but there's more. There are more higher paid healthcare workers living in some parts of the city, and some of the more predominantly white parts of the city. When we then look at where people live in the city who have a lot of our technical jobs, so our technicians, our physical therapists are, a lot of people really make up a lot of the workforce. They really live throughout the whole city. Like, there's not a lot of distribution there. But then if you look at a lot of our support healthcare workers who may be making some of the lowest pay, if you're looking at people who are in more home health aide or patient care assistant or security roles within healthcare settings, those folks do live more concentrated on the south and west sides of Chicago, and there is more overlap with Black Chicagoans and Latinx Chicagoans in those groups. And so while this will be open to all healthcare workers, we anticipate doing additional outreach and work in some of the parts of the city where we may see less vaccine uptake. We were looking to Uber and Lyft, for example. Are there ways that we can think about providing free transportation for people who live in the parts of the city where it may be not as easy to get a vaccine? Can we make sure there are free rides available? So there will be the opportunity to work to make sure people get appointments. And because this will be appointment-based, at least initially, in all of our mass vaccination sites, we'll be able to have outreach workers who will literally have iPads and be helping people make their appointment to get vaccinated. So there's a lot of pieces in that, but really thinking about equity, even with our hospitals in Chicago, we worked to make sure it wasn't just the big hospitals. Our big hospitals, our small hospitals, all of our hospitals getting vaccine really at the same time here in Chicago, and we're supporting all hospitals to ensure that people can get vaccine really when it's their time in line, and you'll be seeing some more of that. Did you want to add anything else, logistics there?
Yeah, and when we talk about point of dispensing sites, those are your traditional brick and mortar locations, and those are geographically dispersed across all the city of Chicago. So there's not one particular area in the city that doesn't have access to a large point of dispensing site. But when we're looking at those community champions and we're looking at how do I get the information shared, we will migrate into smaller points of dispensing locations that get down really deep into the community. So very similar to what you saw with the testing side of the house. Community partners said, I have a very large area and a large either congregation or a large workforce that really needs this service. And we'll be partnering our mobile application of vaccination into those areas. So if there's a comfort level about going to a large point of dispensing site, but I'm more comfortable going to my traditional, where I generally go to meet my friends, where I generally go to have activities, we will be migrating the campaign as additional vaccine comes to market to make that deeper penetration into our communities.
Yeah, and getting back to the second part of that person's question, she was wondering, when is broadly vaccine going to be available in Chicago? We don't know for sure is the bottom line. We have some projections, and Chris's team has worked very hard to think about how many vaccines can we get through over what time frame. But a lot of this depends on all of the vaccines that are in trials right now. Will they perform as well as these initial vaccines have done? Will their safety and their efficacy be good? Will more of them become available? How quickly can we protect them? How does our cold chain do? What is uptake like in Chicago? Are people going to be accepting of this vaccine, which we very much hope they will be? And all of that plays into sort of how long is this going to take. At the highest level, we do anticipate, again, there's about 400,000 healthcare workers. There's tens of thousands of people in our long-term care facilities. We're going to be very focused on healthcare workers really for the first few months here. And I would say probably a little later in the first quarter is when we will start to expand out to some of those next priority groups. I think realistically, especially if we're talking essential workers and getting into older people and people with underlying conditions, that is hundreds of thousands of people, and that is going to take a number of months as well. So really we think about the spring being probably broadly about those groups, and probably just high-level guess more as we move into summer if the vaccines do well. We're hoping by then there will be enough vaccine available that it will be widely available. You'll be able to get it at your provider. You'll be able to get it at a lot of these smaller community-based settings. And importantly, children, are not part of the initial vaccination plan. The safety trials and the efficacy trials have not been done in children. Obviously, we want to make sure that any vaccine is safe and effective before it's available for kids. And so the earliest we would anticipate vaccinating children would also be really summer at the very earliest, I think. And so it's going to be a year of vaccinating. 2021, I said earlier today, if 2020 was the year of the mask, 2021 is going to be the year of the vaccine plus the mask. I think, we're hopeful that by summer, if we have a large percentage of the population already vaccinated and we can really move up and go bigger from there, we will really start to be able to put COVID behind us. And I'm feeling very optimistic, that by this time next year, certainly it's going to be primarily in our rearview mirror. But a lot just depends on the logistics, on the uptake, and really how this goes here in Chicago. Okay, lots of questions. Juan Rangel is asking, will there be a choice to which vaccine you receive? Does it depend on your healthcare provider or what's available? Chris, do you want to start with that one?
So vaccine choice, I'm gonna couch that a little bit. Right now we have one vaccine. As new vaccines are introduced into the marketplace, there'll be additional vaccine available. The key piece to this is, at least in these first two vaccines that we know of, you need to receive this first dose and the second dose of the same vaccine. So as additional vaccine is introduced into the marketplace, you need to know, as the recipient of that vaccine, I received the Pfizer vaccine or I received the Moderna vaccine, so that we're ensuring that you're getting both doses of the same drug.
Yep. Do you want to chime in there too?
Yeah, and I think, in these beginning stages, vaccine supply is really limited. And so currently we only have one. We anticipate we may have two in the near future. But while vaccine supply is so limited, odds are there won't be much choice, because there just won't be much vaccine available. And so you'll be recommended to receive the vaccine and to get the one, available to you at the time, so that you're protected sooner rather than delaying protection to wait for the one that you prefer to have.
Yeah, that's exactly right. It's possible, months down the line, if we learn that one vaccine turns out to be slightly more protective for people who are older, for example, maybe down the line the CDC and the Advisory Committee on Immunization Practices may make some recommendations, but that is months and months and months away, and probably even years away, I would think. So the bottom line is, COVID vaccines will be available only if they've been shown to be safe and effective, and we'll be working to push them out. And it really depends on the setting that you are getting vaccinated in that we'll be following. We will, behind the scenes, certainly be following which kind of vaccine people are getting. All of the side effects follow-up, all of the safety follow-up will happen for all vaccines, so rest assured on that. Okay. Sarah Cantor is asking, will the vaccine be available or recommended for kids under the age of 10? I'll take that one quickly. We don't know yet. The expectation is that the vaccine will probably be recommended for children, but the trials are not done. And only when those trials are done would that question be answered. And that is going to be summer at the very earliest, I think, when we would potentially be vaccinating children. So you're going to have to wait on that. The good news is that children, by and large, one of the few good news about COVID is that children are much less likely to have severe infection, need to be hospitalized, et cetera. And it's one of the other reasons why they come a little bit later in the prioritization queue. But the more important part is the trials. So we're going to have to wait and see on that one. Okay, Faith Pennick, will the vaccine be free?
So yes, the vaccine will be available at no cost to the vaccine recipient. Even to become a provider who gives COVID-19 vaccines. So for a healthcare provider who wants to provide that vaccine to their patients, et cetera, they had to enter an agreement, which we call the COVID-19 Vaccine Provider Agreement. And it's between them and the CDC, where they agreed that they would provide this vaccine at no cost to the recipient. And so it will be free and no cost to the person receiving the vaccine.
Yep. Anything you want to add to that?
No, I think that's good.
It's a good, straightforward one and a good answer. All right, Deborah Cunningham is asking, I'm allergic to eggs and I can't take flu shots. Can I take the COVID vaccine? So always I refer any individual to their doctor to have a particular conversation about their situation. But at the highest level, what I would say is that the good news is that these vaccines are not being made in the same way that the flu vaccine is. There's no eggs involved. There is no virus. As you heard Dr. Robinson say, this is not killed virus. This is not inactivated virus. This is not a part of the virus. It's literally the messenger RNA is just giving the message to your cell to teach it how to protect you against COVID. But there is no eggs related here, and that would not be an example of an allergy that would be a contraindication to vaccine. Again, I refer anybody to their individual provider about the specific comments, but at the high level, that's the answer. All right. Joanne Palmer is asking, when will teachers be vaccinated?
Yes, so our teachers will likely be considered part of our essential workforce. So at the point when the federal government provides the guidance on which group is next, and we expect it could be essential workers or persons over 65 or persons with certain medical conditions, teachers will be included in that group. Now, as Dr. Arwady has mentioned, we expect it will take us some time to finish the healthcare provider category and the long-term care facility residents. But once we get through that group and move on to the next group, wherever the essential workers are, there are the teachers.
All right. Eunice Winston Jr. If there are adverse reactions to the vaccine that take place beyond the first 15 to 30 minutes of receiving the vaccine, for example, months or years later, what is the protocol? Good question. So a couple things here. Where we think about allergic reactions, those almost always do occur really within those first few minutes. That's why there's a requirement to monitor right away. But as part of the V-Safe program, people are not required to, but will be encouraged to, through their cell phone, be enrolled in a program that literally will text them daily for 1 week after they have received COVID vaccine, and they'll be able to respond back if they're having any side effects, if they're having any problems, if they're having any questions. It then checks in with people weekly for 6 weeks, and then it actually checks in with them again 3 months down the line, 6 months down the line, 12 months down the line. There are folks at CDC actually monitoring all of this data coming in from the hundreds of thousands of people getting vaccinated across the U.S. And if there are concerning things that they're seeing, they will reach out directly. They're otherwise looking for patterns. And then in addition to this, what we call sort of active data collection, there's a lot of behind the scenes work. So we will be following in a lot of the large data systems any signs for any safety concerns, really doing a lot of follow-up, matching a lot of data. Again, this is routine for any vaccine or any drug that's approved to make sure that we continue to learn about it. But that's some of what the follow-up will be looking like long term. The good news is that the FDA waited. Somebody asked me the other day, why did it take the FDA longer than some other countries to approve this vaccine? The FDA required 2 months minimum of follow-up data after completing the vaccine. And that's because it's really very rare to see problems emerge, months and years later. 2 months of follow-up based on all the prior vaccine history we have really is a good amount of time. Not all of the regulatory agencies required that amount of follow-up time. I think it's good that they did. Again, I most care about this vaccine being safe. And so that is the amount of follow-up that was done in the phase 3 trial. But those trials are continuing. They're not done. All the people enrolled in that trial will be followed for at least a couple of years, potentially longer, and that's true for all of the trials. Okay. So we've got some questions here about undocumented people. Evan Lyons asking, will undocumented people be able to receive the vaccine? What plans exist to reach undocumented people? And also asking about people in congregate settings. How will homeless, people in substance use treatment programs, halfway houses, et cetera, be reached due to this risk? So I think let's start with the congregate setting part and then come back to the undocumented. Do either of you want to start off on that?
Yeah, so we're going to get some additional guidance on the next groups that are recommended for vaccination. And then, of course, we'll be working with, providers who provide vaccination and provide services to homeless persons currently to get vaccine in those settings. We'll also be working not only with the partner organizations, with pharmacies, and we'll also still have access through our services at CDPH to assist with some vaccination when indicated. So there'll be multiple ways we'll be going about vaccinating persons in congregate settings, but we're going to get the additional guidance here this weekend.
Yeah, and I would just say that, really here in Chicago, we are very much planning to vaccinate in those other congregate settings just as soon as we're able to. We've seen a lot of outbreaks, and we know these are high-risk settings where people are living close together, and so we certainly plan to vaccinate that group really very, very early as soon as we move beyond that next group. And to the question, anything you wanted to add to that part?
No, I think you hit it. The key piece for us is working with our partner agencies that know this particular population. So a strong coordination with this group so they're getting the appropriate messages, they're getting the accurate information, building that trust up within the populations that you identified here to ensure that their willingness to take the vaccine. And whether that is you're going to a location to receive a vaccine or if one of our programs is bringing the vaccine directly to you.
Perfect. And on the questions about undocumented people, will undocumented people be able to receive the vaccine? Absolutely. We will not be requesting, just as we have not in our City of Chicago testing sites, we will not be asking any questions about documentation or citizenship. We do need, of course, to keep track of who is receiving this vaccine to make sure that they can get that second dose and that there's follow-up in case there are any issues related to that. But there's been a lot of conversation about how to ensure that that data is used for public health purposes. And so I think related to specific plans to reach undocumented people, we do have, in addition to, there's been some specific work already, and there will be much more thinking about what kind of specific messaging might be needed in the Latinx community, for example, that goes far beyond just language. And it's not just that it's Latinx, but that's one example. We will also be working with partners and with some of the outreach groups that will be working on our messaging to think about how to make sure people who are undocumented feel very confident in terms of getting vaccine. We also, when we get to essential workers, recognizing that there may be people who are undocumented in that setting or working kind of gig employee workers, we think having vaccine potentially available through workplaces with a vaccinating partner will also be a way to encourage people to get vaccine. Okay. And the Office of Representative Jan Schakowsky is, I think, following up on that. Will persons seeking to get a vaccine, the first phase for healthcare workers and long-term care facilities, be required to show ID of any kind? Do you want to start with that?
Yeah. Because these sites will be considered closed point of dispensing sites, you will have to do a pre-registration. So if I was an individual eligible to receive that vaccination, I do my pre-registration, I identify my clinical practice, and then when I present at the point of dispensing location, we will look for the credential that says I'm affiliated to this medical facility, this particular hospital, and then you'll be checked in for the process.
Yeah, and that's especially sort of in this very first phase where we're wanting to make sure we really are vaccinating people who are healthcare workers. As we sort of are moving ahead and there's more and more vaccine available, we are not anticipating requiring identification per se where we're in the essential work phase, et cetera, but we are going to need people to register with their information. Again, it's important that we can follow up if there are issues. It's important that we can ensure they get the second dose. And we imagine, back to one of the earlier questions, there probably will be settings where people will want to be able to show that they have been vaccinated. And so for all of those reasons, we will need people to register, but we are not requiring people to show formal identification, at least at this time. That's not the plan. Okay, Venus Frazier is asking, does free mean insurance is not required or charged? Yes, and we can put a little finer point on this, but all of the vaccine that is being made available is from the federal government. It's been, this has been about a $10 billion operation to develop these vaccines here in Chicago. In Chicago and around the country, around the world. It's about a $10 billion operation, and part of the plan really from the beginning was to ensure that vaccine is available free of charge. So the city of Chicago is not charged for this vaccine. We will not be charging providers when we give it to them, and the individuals will not be charged. That said, it is possible that if you are getting vaccine in a clinical setting, particularly in the context of another clinical appointment, if you're seeing your doctor for something else, you might get charged for a visit, for example, in that setting. We will be learning more and sharing more about things like copays, things like insurance, but absolutely our goal is to make sure that there are no barriers, and especially no cost barriers to vaccine. Do you want to add in just about what we'll be doing on our sites related to payment?
So we will not be collecting payment at any of the city-managed points of dispensing sites. There is the registration process so that we know how many vaccines to bring to that particular location to service the number of clients there. There is the check-in process to validate that you are pre-registered for your vaccination, but we will not be collecting any fees associated to that dispensing.
Yeah, and that's a period. Doesn't matter who you are, doesn't matter where you're coming from. We will not be requesting any money at all. all to be vaccinated. And we expect that that will be the setting in the huge majority of places where vaccine is available. And under no circumstance will you be able to be charged for the actual vaccine. Okay, Rose Avalos is asking, will prenatal moms be vaccinated after delivery?
So the CDC did make some recommendations with regard to pregnant women and the vaccine. So, pregnant women should, of course, discuss with their provider vaccination. And, if the woman chooses to, and after discussion with her provider, she can be vaccinated with the COVID-19 vaccine. And there are, for people who are postpartum or already had the baby, they can also be vaccinated.
Yeah, and I think, I think Rose may be wondering, she may be familiar, we often will give vaccines when people are in the hospital right after delivery if they're missing it. I think it's possible down the line that could very much be part of a hospital's, regular plan of care, but not yet, right? This is down the line when vaccine is very widely available. So good question. Marilyn Samuels, will the city update its website to show how many vaccines have been administered daily or weekly? Yes. So we mentioned this already. We will start sharing at a high level what our vaccine numbers look like, and then as time goes by, we'll be sharing more demographics in the same way that you've gotten used to. All right, I think this is our last question for the evening. Once I get the vaccine, do I still need to wear a mask? Do you want to start us off?
Answer, but yes, once you get the vaccine, we'll still need to do all of the things that we have been doing for months now to protect ourselves against COVID. And so you'll still need to wear a mask, you'll still need to social distance, particularly in those early phases of after the vaccine is rolled out. And particularly, like Dr. Arwady mentioned earlier, while we know there's still a high level of COVID in the community.
Yep. So I think we're coming up on the hour here, but I thank you for all of the questions. If we didn't get to your question today, put it in the chat box. We continue to really update our frequently asked questions online, and I encourage you to go back to that website, really explore it, give us feedback, let us know if there's other things that you need. Again, I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. This is Dr. Candace Robinson, one of our medical directors at the Chicago Department of Public Health, and Christopher Shields, our Assistant Commissioner for Emergency Preparedness. And we are just some of the team that is working very hard to bring vaccine to Chicago. Right now, we're doing healthcare workers, we're doing people in long-term care facilities, but in the months to come, this will be expanding out in a way that is equitable and is as effective as we can be in terms of bringing this vaccine widely to Chicago. We do think that this vaccine is going to be at the heart of protecting Chicago, and it is going to be how we get past COVID as a city. So thanks for all of the questions. Thanks for tuning in. There will be lots more opportunities to learn about vaccines. And in the meantime, please keep doing the things that you know work. Wear your mask, socially distance, wash your hands. Don't have people into your home who don't live there. And even in this, end of December time, which is such a normal time for us to gather, it's not the time to be gathering. There is still a lot of COVID here in Chicago. The risk is very high. And although vaccine is bringing us hope, it is still at very low numbers. So with that, thanks for signing in, and we look forward to answering your questions again soon. Bye-bye.